of the medicine open days. So welcome. I'll try and make it, a bit more interactive, a bit more personal, because obviously there's not many of you at this stage in the cycle, and rather than just sort of spouting words at you, we can get you a little bit more involved. I'm Drew Tarmy. I'm head of admissions for the medical school here in Manchester. Welcome. I'm sure you've had a good look around the university and been to lots of talks. The best advice that I can give you for applying to medical school or dental school is visit as many schools as you can over the course of the next year, and some of them will feel right, and they're the ones to apply to. People get very hung up on obviously application statistics, and it's only natural to want to predict which universities you'll get you're more likely to get an offer for. Do focus on going to the schools, chatting to the people, speaking to the current students, and seeing whether you'll like that university in that city, because you've got to spend 5 or even 6 or potentially even more years at medical school, so it needs to be the right place for you. So just a quick show of hands from you. Is anyone pressing the send button later on today on their application? 1, 2. Yay, excellent. Okay, so good luck with that. Good luck with that. Obviously, our deadline is today, so make sure you get your applications. In. The rest of you, I'm guessing you're looking at 2024, and you're just super early for the next cycle, which is great, and it means that you don't have to squish into the talks in the open days in June. Although you're more than welcome to come. Okay. So let's talk to you a little bit about the programme and the way that we deliver medicine here at Manchester. So we're different. If you go on the internet or even talk to careers advisors and teachers, they'll often tell you that there are different types of medical programme, and they'll probably distill it down to saying that there are traditional courses and there are problem-based learning type courses. And the traditional courses might sometimes call themselves integrated programs. There's all sorts of different terminology. There's CBL, there's PBL, there's EBL, there's TBL. There's all the BLs that you could possibly want. It's a continuum of different programs. There are basically no traditional medical degrees left in the UK, and there are no purist PBL degrees left in the UK. We're all somewhere in between. We all use different methods of teaching. At Manchester, we think that we've got one of the best mixtures of teaching styles. So we use lectures. So every week you'll have lectures on specific topics. Every week you'll have some dissection in years 1 and 2 of the course, so we do full body dissection throughout the first 2 years of the programme. You have laboratory classes in physiology and pharmacology, we're quite an academic school, so we do have quite a lot of laboratory science in years 1 and 2 of the course. We also have really small group teaching, things like problem-based learning and team-based learning, case-based learning that follow you through the whole 5 years of the programme. So at 1 minute you might be in a lecture theatre. I'm here next week actually, doing something about vestibular function for the second year students in their neuro block, and you'll be in a lecture theatre with 430 other students. Then the next minute you might be in a TBL group with 12 other students or 11 other students, and then you might be going to a laboratory class with a group size of 30, and then you might be going to a communication skills or clinical skills teaching session where you've got a handful of students to assimilate a patient and a teacher. So you've basically got such a huge variety. We've got a combination of large group lectures, and we've also got innovative small group teaching. So we're different. We're a mixed methods curriculum. So we use case-based learning. We're actually under a transition at the moment. So you might have heard that Manchester's synonymous with PBL, so problem-based learning, where you follow a patient through their journey. You start them off. So let's say, for example, Mrs. Smith. You've got 2 PBL sessions a week. Mrs. Smith presents to her GP with chest pain, or she presents in A&E. With chest pain, okay, and you take that patient and you follow them through their journey, from initial presentation right through to follow up. So you get together with your group, small group of students with a tutor, and you say, Okay, well, what are the potential causes of Mrs. Smith's chest pain? Go on, give us a couple of answers. She's got chest pain. What might cause Mrs. Smith's chest pain? Yeah. Angina. Yeah, angina. Could be angina. Anything else? You're really quiet. So she could have angina. Heart attack. Yeah, she could be MI. It could be a heart attack. She could be having a heart attack. Anything else? Stroke? Anything else? Yeah, she could have dyspepsia, couldn't she? She could have indigestion. Particularly the older members of the audience might be more familiar with that than the sort of 18-year-olds. But yeah, she could just have something like dyspepsia, indigestion. It could be all sorts of things. It could even be a respiratory cause. It could be that she's pulled a muscle or something like that. You know, there's lots of different causes. So in your group, you'll think about those differentials, those differential diagnoses. Your tutor will guide your thinking. And actually, your tutor, you might think about some musculoskeletal cause of that chest pain, like a muscle pull or something like that. And your tutor will guide you, and your tutor will say, actually, we're not looking at the musculoskeletal system this week, so park that idea and look at something else. And then you'll be thinking, well, actually, what are the potential causes? Okay, what questions do we need to ask Mrs. Smith about this chest pain? So throughout the week, you'll have some consultation skills sessions. So you'll go into our consultation skills suite in the Stopford building, and you will work with tutors and you'll work with actors, simulated patients, and you'll learn to take a cardiovascular history from a patient. You'll learn in your clinical skills classes, you will learn how to perform a cardiovascular examination on that patient. In the physiology pharmacology classes, you might be learning how to record an ECG. You might be learning how to do various sort of laboratory tests and interpret laboratory tests. And you'll have lectures on pharmacology, so you might find that Mrs. Smith's taking a beta blocker or she's taking some other drug, and you'll be thinking, well, actually, how does that drug work? What are its mechanisms of action? What other drugs are available? How does it all work? Sorry, this seems to be ringing. Put it down there. Across the course of the week. We pride ourselves on clinical immersion, so in years 1 and 2 of the course, you'll be largely based here on campus, so using lecture theatres like this one, and you'll be here on campus. In years 3, 4 and 5, you'll be allocated to a hospital site, so you'll be allocated to a clinical education campus, which is like a mini medical school out at one of the big trusts that we work with. So we work with MFT, which has got 2 main sites. So it's got the Oxford Road site, which is just down the road from here, and the Wythenshawe site, which, if you're not familiar with Manchester, is out near the airport. We've got a base at Salford Royal. We've also got a base at Preston, up in the north of the region. So we've got quite a broad geography of places to go. So what will happen is you'll be allocated to a clinical education campus, and then you'll rotate out to district general hospitals. You'll rotate out to community placements, things like mental health and GP in years 3, 4 and 5. So because we've got this really spread out geography in terms of our clinical placements, we've always been really good at technology enhanced learning, because it isn't possible. If some of you are in Crewe, some of you are in central Manchester, some of you are in Salford, some of you are on the Isle of Man for a few weeks, it's not possible to get you all back here for a Friday afternoon lecture. So we use a lot of technology enhanced learning, and we have been doing for many, many years. We were recognized by Apple as a center of excellence for technology enhanced learning. We use iPads to maintain a portfolio, to get your clinical skills signed off, to get your placement signed off in years 3, 4 and 5. One of the things that our graduates always say is that we're really good at preparing them for practice, preparing them for those first jobs that they will have as a junior doctor on graduation. So I'll just show you a few pictures of the site. If you've already visited the Stopford building today, that's the spiritual home of the medical school. It's a 1970s building, but it's been refurbished quite extensively inside. Here's the medical library. I won't dwell on these for too long. There's lots of study spaces, lots of bookable spaces. There's the textbooks are out of shot here, but lots and lots of resources. We use simulation quite a lot, particularly in years 3, 4, and 5. So when you, I'll show you a plan of the program shortly, but at the start of year 3, you have a block of teaching. We teach clinical skills and communication skills in years 1 and 2, but you have quite an intensive block of clinical skills teaching when you start year 3 to prepare you for practice. This is a Laerdal SimMan. They're really good. They're quite interactive. We can speak through them. We can take blood from them. You can program them with things like a murmur. They breathe. They have pulse. You can get interosseous access on them. You can practice working in a team with a whole range of professionals. So we use lots of simulation, particularly in year 3. So, thinking about the course content itself. So what I'm going to do now is talk a little bit about the structure of the program. We'll be joined shortly by some of our admissions team and a couple of our current medical students. So feel free to ask them. So think about some questions to ask them, and you can ask them about their placements and where they are, because they're in year 4 and year 5. So let's start off with year 1. You've all come from lots of different educational backgrounds. Some of you might have studied Scottish Highers, some of you might have done International Baccalaureate, some of you might be graduates, other people might have done A-level. So you've all learnt in different ways and learnt slightly different things. So Essential Skills is a short study block at the very, very start of year 1, and that aims to bring you all up to speed, to get you used to the way that we teach and the way that you learn here in Manchester. And then we go into 2 semesters. So there are 2 semesters per year, semester 1 and semester 2. Semester 1 is really before Christmas and into January, and semester 2 runs for the rest of the academic year up to the summer holidays. So you do have a normal summer holiday like you would if you were enrolled in any other program in the university in years 1 and 2. That's not the case in years 3, 4, and 5, where you're on placement for a lot of the time. But you do have a decent summer holiday in year 1 and year 2 anyway. One of the ways that we structure our program is based on cases. Each week you meet a different virtual patient. You do a different case. It differs from the way that some medical schools structure their curriculum. So some programs, particularly quite traditional programs, in any given week, you might have a lecture series on different topics. So you might, for example, have a lecture series on endocrinology, and every week you might have an endocrinology lecture, and every week you might have a neurology lecture, and every week you might have a respiratory lecture, and there'll be sort of multiple parallel themes running through the curriculum. We don't do it like that. What we do is each week, you'll see that patient, you'll manage that pathology, you'll learn about that pathology, so you'll have lectures, you'll have practical classes, you'll have small group tutorials that cover that particular pathology, and then you'll move on to another one. Okay? So you might have a group of cardiovascular cases where you look in the cardiorespiratory semester in year 1, you might have hypertension, high blood pressure. Then you might do MI, heart attack. Then you might have a case on valvular disease. And then the week after, you'll move on to the respiratory block. So you'll look at things like COPD, you'll look at asthma, you'll look at, dare I say it, COVID and respiratory tract infections and things like that. Life cycle is a semester that covers embryology, so lots of embryology, child development. It covers reproduction. It covers end-of-life care. So it basically gives you an overview of the full human life cycle. We have early clinical experience, or ECE, in years 1 and 2. We've just increased the amount of early clinical experience that you have. ECE is where you go on to GP and hospital placements in year 1 and 2. So these are taster placements. They're quite short placements, but they give you a taster of what it's like to apply your knowledge in a clinical setting. Into mind and movement in year 2. So mind and movement is musculoskeletal. It's an introduction to neurology and neuroscience. It's an introduction to psychiatry and things as well. So you'll be studying things like the dementias, for example. Next week, we're looking at balance disorders in year 2 in mind and movement. Parkinson's disease, other motor, kind of motor problems, depression, psychosis, bipolar disorder, and then we go into the second semester in year 2, which is nutrition and metabolism. And nutrition and metabolism covers the alimentary tract, the digestive tract, so everything from the mouth and a little bit about teeth and dentition, through to stomach ulcer, gastric ulcer, or duodenal ulcer. We look at bowel cancer, we look at all the accessory organs like the pancreas, we look at the liver, we also look at metabolism, so thyroid and thyroid dysfunction. We look at the renal system as well. There are more early clinical experience placements. Running alongside the whole of this, we've got a personal and professional development program, so you're keeping a portfolio of the patients that you've seen, the skills that you've learned, and you're reflecting on those. We've got something called the Personal Excellence Path, which is your opportunity to engage in research. In year 1 of the course, you prepare a poster presentation as if you were going to a scientific conference on a topic from the literature. In year 2, you do a literature-based project and write an extended dissertation. In year 3, you carry out your own research project, so that might be an educational project, it might be a clinical project, an audit, something like that. It might be a literature-based project, it might be a laboratory-based project. In year 4 and year 5, that PEP takes on a slightly different flavour, and it's quality and evidence. So it's things like clinical audit, improving experiences for patients, and doing research like that. Year 3 of the course is largely general medical and general surgical placements. So, general surgery, respiratory, cardiology, things like that. Year 4 has more of a sort of specialty flavour. So neurology, dermatology, different specialties. In year 4, you've also got a student selected component, which is where you can say, okay, I've had one of these placements so far, but I'm thinking for my career, I'm thinking about going into this specialty. So I might spend a bit more time in whatever specialty that might be. O&G, or it might be something like dermatology that you might not have had a lot of before on the program. You've also got an elective in year 4, so the elective is a block where you can go and do something completely different. So a lot of people travel for their elective, they go overseas, they see what medicine's like in a different country, they go and experience something different. And it's probably your sort of last opportunity to travel and do something fun but related to the curriculum before you start your first jobs, really, once you graduate. So a lot of people enjoy their elective. Some people do research electives. You can do the elective in the UK. You can do your elective overseas, entirely up to you. So lots of people travel to all sorts of amazing destinations around the world. I had a student the other year who did it in Wigan. So it's entirely up to you. You can go wherever you like. Year 5 has a preparation for practice feel. So a lot of year 5 is preparing you for your first jobs as a junior doctor. You're shadowing junior doctors and FY1s. You are not able to do some of the statutory stuff, so obviously you can't prescribe and things like that because you're not yet registered, but you can follow them, you can get used to what it's like to work as a foundation doctor so that you're not out of your depth when you get to that first job after graduation. Okay. Lots of people are asking about entry requirements. So, because most of you will be applying in the 2024 cycle, which is you'll be starting in 2024, which is the 2023 cycle, I've put some information here for people starting in 23 and in 2024. The A-level grades aren't changing. Our standard A-level offer is AAA, or 37 points if you're doing the International Baccalaureate. Our GCSE grades aren't changing between 23 and 24. So it's 7 GCSEs at grade 7 and a minimum of a 6 in English language and maths. And I'll tell you how we use those as part of the selection process on the next couple of slides. So we don't, if you go to some medical schools, what they'll do is they'll weight different bits of the application. So they might give you 20% of the decision to interview you or not coming from the GCSEs. You might get 30-odd or 40-odd% coming from the UCAT or BMAT test that they've made you sit, and then various bits from others. We don't do that. We have a threshold-based system which I'll talk to you about in a second. One of the changes that we are making between 2023 and 2024 centres on the UCAT. So for 2023 admission, we'll accept UCAT SJT band scores or situational judgment test band scores, band 1, band 2 and band 3. We will prioritise bands 1 and 2, but we'll still accept applications from people with a band 3. From admission in 2024, we'll no longer be accepting people with a band 3 SJT score. So you'd have to have a band 1 or a band 2 SJT score and then meet our threshold, which I'll talk about in a second, for the UCAT. But we get lots and lots of questions about UCAT and aptitude testing. So those of you that are just beginning your journey and starting to think about applying to medical school, or to dental school actually, because it's quite similar, there are two different selections. There are actually more than two. There's one for graduates as well, but we'll not talk too much about that. BMAT and UCAT are the two main selection tests. They've got a lot of overlap. They can be quite similar. Effectively thinking about them as IQ tests or ways of selecting medical students. BMAT's a little bit different. So you'll sit, most medical schools in the UK use UCAT. There are a handful of medical schools that use BMAT as well. So find out a little bit more about the medical schools and then think about the selection tests that they use. So we use the UCAT, so it used to be called the UK CAT. It was renamed a couple of years ago. And we often get asked questions about work experience. So all medical schools were sort of on a work experience journey, even pre-pandemic. So if you go back many, many years, some schools would require shadowing experience with a doctor or another healthcare professional. We changed that to require caring experience. So a lot of our applicants will have done voluntary work in care homes. They'll have volunteered for charities that work with disabled adults and children. Hello. We've been joined by our current students and Louise, who's our admissions manager. So we'll be able to answer all your questions a little bit later on. We've changed our approach to work experience. We will accept both online work experience and face-to-face work experience, or a combination of the two. Please don't get too hung up on work experience. It is something that lots of teachers and sort of advisors will sort of talk to you a lot about. It is becoming less important in applying to medical school and applying to dental school too, if you're thinking about both. You need to have enough work experience to show that you understand what you're getting yourself in for, really. So you need to have enough work experience to show that you understand what's involved in being a medical student and working as a doctor. But please don't feel that you need hours and hours and hours and hours and hours of work experience. Do concentrate on your studies as well. So what sort of work experience might be acceptable? Well, it's that sort of care home work experience, volunteering, as I said, with adults and children. It could be that you have a part-time job in a healthcare sort of area. It could be that you've gone on a structured work experience program. So some NHS trusts and GPs will organise structured work experience programs. It could be that you've been to a summer school for medicine. It could be that you've been to outreach events and open days. A lot of the Royal Colleges, particularly RCGP, which represents GPs in the UK, they've developed some really good online work experience packages that you can do too. We don't assess your work experience before interview. So I'll talk about the NAIF in a second, our non-academic information form, but we don't look at your work experience until you get to interview. And then your work experience will be part of a discussion that you have with your interviewer in one of the interview stations. Okay, and on to the non-academic information form. Are you all preparing? You're thinking about your personal statements? Yeah, potentially. We don't read them. So there you go. So most medical schools have stopped reading personal statements. There are a handful of medical schools that do. So if you are applying to one of those other medical schools, then yes, you do need to write one. The personal statement is not really used for medicine for most schools. You can leave it, if you're just applying to Manchester and similar schools, you can leave it blank. If you are forced to write one at school, then you haven't wasted your time, because what we'll do is we'll send you a non-academic information form. Most other medical schools will do something similar, actually. This is a structured personal statement, effectively, where you can tell us the things that we specifically want to know about you. So tell us about your motivation. Why are you applying for medicine? For some of you, it might be very cliche. Granny was ill when you were 7. And you saw the wonderful doctors and you saw the healthcare professionals, and I see you smiling on the front there. So you saw these healthcare professionals and you thought, I want to be one of them. Or it could have been, I'm going to Nadine's journey, where you went sciences, and then she basically thought, I'm good at science, I'm going to do a science degree. And then she thought, actually, I like people as well as science, so I'm going to go and do a medical degree. And then actually she's doing a PhD as well now, so she's sort of going to be professor of medicine, I think, at some point. So your motivation can be whatever you want, whatever is personal to you. Okay, just tell us a little bit about your journey to get here. Your work experience, whether it's online or face-to-face, or a mixture of both. An example of when you've worked in a team, because doctors and medical students work in teams all the time. Again, we don't have a favourite list. You don't get 11 points for playing the violin and 9 points for being captain of the rugby team or whatever. It's not 1970, we're not bothered about those sorts of things anymore. It's whatever is important to you. Same with your hobbies and interests. You know, you don't get not specific points. Yeah. So do you get sent this once you apply? Yes. So once you apply, we'll send you this form through. Oh, you won't. So you've applied for this year. Yeah. So we wait for all the applications to come in. We do some of our sifting. So really, it'll be in November. About 2 weeks' time. Oh, they're super fast and super efficient, is our Louise. So, but it's nearly November in 2 weeks' time, isn't it? So, no, it's all right. So we'll send you it in a couple of weeks' time, once you've applied. Good point. Hobbies and interests. Again, it's whatever makes you tick. Why are we asking you for your hobbies and interests? We're asking you about your hobbies and interests, partly because we want to know about you managing your work-life balance and things like that, but also because we're interested in you. The people that are interviewing you. It's a bit strange when you're applying for medical school, because most people that start medical school will finish medical school, so the dropout rate is very, very low. And then when you start your first jobs as a junior doctor, as a foundation doctor, there's a national selection process, but you don't really have a job interview in the sort of conventional sense. So your interview for medical school is basically your interview for the profession. So one of the reasons people are asking you about this is the people that are interviewing you are people at the university like me, my colleagues, current medical students, graduates, alumni, people working clinically, lots of different healthcare professionals, and a lot of them aren't planning to retire before you start work. So one of the reasons they're asking you about these things, about hobbies and team working and motivation, is to show that you'll be a good colleague in the future. So have that at the back of your mind whenever you're going to a medical interview. It's not just about what the university wants and what the study's about. It's about, will you be a good colleague and a good doctor in the future? Okay, great. So our selection process will look like this. Again, this is 2024 selection. Very, very similar for 2023. First thing that we'll do is, obviously, we'll send out things like the NAIF. We'll do an academic sift. So really this will mean checking things like your GCSEs. Do you have the GCSEs that you need for the program? If yes, then you move on to the next stage. We don't weight the GCSEs or anything like that. So if you meet the minimum, which is 7 GCSEs at grade 7 or 7 A's in old money, then you move on to the next stage. We're not really bothered if you've got all of them grade 9s or you just meet the minimum. It's threshold based. So then in November what we'll do is we will look at the number of interview slots that we have, between 1,400, probably be around 1,400-ish actually for the next cycle. Interviews, we've got 397 places, so we'll select a UCAT cutoff to bring enough people to interview for the number of offers that we're anticipating that we'll make. So we use a UCAT cut. We're just updating the data on the website at the moment. Last year's UCAT cutoff, the standard cutoff, was 2,730, which was quite high actually compared to some of the historic data. And they go up, they go down depending on the year. We do have reductions for people that have a WP flag or a widening participation flag. So if you come from a postcode that doesn't send many people to higher education, or you go to a school whose exam results are a bit below the national average, then you might have a widening participation flag, so you might be eligible for a slightly reduced UCAT threshold. You can find out whether you're eligible on the university website. And then what we'll do is we'll start interviewing. So for this year, we're planning to offer both online and face-to-face interviews, and you'll get a choice, first come, first served, when we issue the invitations to interview. The interview format is the same, whether you choose to do it online or face-to-face. Start interviewing towards the end of December, and we'll finish interviewing towards the end of February with a couple of mop-up dates, possibly a little later in each application year. Please bear with us. I know it can feel like you've applied on the 15th of October, and then it takes us a while to do the sifting and to look at your non-academic information form. But last year we got 3,500 applications. It is a manual process. If we're interviewing 1,400 people, it takes us a long time to get through 1,400 people. That's more than most of the big graduate recruiters recruit in the course of a year. And then we'll start sending out offers, often in batches, towards the end of the year. And just the last thing for me to finish up on, really, before we do a bit of a Q&A, is thinking about your interview. So at the moment, we have a 5-station multiple mini-interview. So that's a bit like interview speed dating. So what happens is, whether it's in person or face-to-face, if it's in person or online, you'll have different stations. In this case, you'll have 5 stations. And we do vary the topics and we vary the scenarios. You go into that station, you're timed moment for 8 minutes. The interviewer asks you a series of questions, or you perform some sort of task or activity in that station. A buzzer goes and you leave the station and you go into the next station, and a different interviewer asks you a different set of questions. Then you leave that one and then you go on to the others, and you rotate round in a circuit until you've finished all of the stations. So at the moment we've got 8-minute stations and we've got 5 8-minute stations. We might change that in the future, but that's the number of stations that we have at the moment. And so what are they assessing? They're assessing these things. Our interview is quite friendly. We don't have numeracy tests and things like that, like some medical schools do. We're largely conversational. It is, enjoy it. It's a nice experience. It's 5 people that are really interested in you and your journey to medicine, so do enjoy it. So we're testing your communication skills. We will have some role play stations in there. We're not looking for amateur dramatics or anything like that, or for you to be a brilliant actor. What we're looking for is your raw communication abilities. We'll test your critical thinking. We might have some medical topics that we discuss. So be aware of medicine in the media, medicine in the news. So we asked things about COVID, and we're not asking that. I'm fed up of asking COVID interview questions, but to say, well, actually, if you were in charge, would you have done anything differently in the handling of the pandemic? What would you have done differently? Would you have been more stringent, less stringent with the COVID measures? Okay. And what we're looking for you to do is, whatever topic we give you, we're looking for balance, and we're looking for you to be able to say, well, actually, there's a load of different viewpoints that you might have in society and within the medical profession. So you might have one viewpoint that says, just ignore it, just kind of crack on and ignore COVID completely and don't do anything. Probably not the right answer. And then there's another one, which is basically trap everybody in their homes forever, which is also probably not the right answer. And the sensible decision is probably somewhere in between. We want you to be able to articulate that and come to your own opinion. Don't be frightened about getting the wrong answer in a medical interview. So whether you decided that we were too strict or too lenient, as long as you can argue the case, then that's fine. As long as you have an opinion, that's fine. We'll look at your non-academic information forms, so an interviewer will be asking you questions about your hobbies and interests and your team working and your work experience. We might give you some problem solving, so one that we used a few years ago was, imagine you're on work experience in a care home and we want you to plan an activity. We want you to plan a trip to the seaside for 80 older residents, or 30 older residents, or however many. And then we want you to go through the steps that you would take to plan that, to organise that. So these are just some examples of the types of interview question that we might ask. Okay, so here we go again. You can ask me any questions you like. You can ask our current students any questions that you like. I'll just ask them to introduce themselves and be thinking of some questions. So you can ask me something about admissions, ask you guys something about your studies.
Hi everyone, I'm Natasha and I'm a third year medical student.
Hi everyone, I'm Nadine. So I did foundation first year and transferred into medicine. I'm currently intercalating in the PhD, as Drew said before. But does anyone have any questions for us? There's no right or wrong question, to be honest.
Yeah, there's one on the end. Right, I've got a microphone. There you go.
Oh, thank you. When in the course do you get the chance to intercalate?
Okay, so after third year and after fourth year of medicine, you get the chance to intercalate. There's an Interglation Fair. So an intercalation basically means a year out or 3 years out if you're doing a PhD, but a year out generally to do a bachelor's degree or a master's degree. And in the fair, what you can do is go around the stalls and then figure out if it's for you or not. But don't worry, it's not a decision you have to take today or when you apply. It's later on. But if you're interested in research as a way forward, definitely.
Anyone can intercalate as well, so it's not a competitive process to intercalate. Anyone can intercalate.
Right.
Yep. I know at some medical schools there's only a set proportion, or you need a specific mark. As long as you passed, then you can intercalate. Yeah. Any other questions, anyone?
It's an informative talk.
Yeah.
One at the front.
Yeah.
I just have a question of why Manchester over everywhere else, from a student's point of view.
That's the main question, isn't it, really? I think, generally speaking, for me, why Manchester is because the style of the programme is very reflective. It kind of builds you towards when you're practising as a doctor, and it's reflective of that in the nature of the programme. So you've got your problem-based learning, where you get the lectures, but alongside of it, you get the independent aspects of learning alongside, I want to say, a multidisciplinary approach with your problem-based learning, where you teach each other as well at the end of the week what you've learned. So for me, it's the hands-on, early, full-body dissections, early clinical experience, all of that comes into play, and the style of lifelong learning that you develop throughout medicine, that when you actually come to practicing as a doctor, it is reflective of that generally, and it's really enjoyable. But I'll leave it to you as well.
Yeah, I'm going to go down a different route. I say I chose Manchester for the city. Obviously I love the course. I just want to put that out there. But I think Manchester's a really good city. I don't think it's too expensive. It's a bustling city. There's so many different students here. There's quite a few universities. The food places are endless. There is so much. If you like going out, you can go out. If you don't like going out, you don't have to go out. There's something for everyone. And I think in medicine, you're doing something that's 5 years, potentially 6, potentially 8. Even 10. So you want to go somewhere where you're going to enjoy it and not get bored of it. And so I kind of chose my universities based on where I could imagine myself living. And I grew up in a city, Birmingham, even though I don't sound Brummy, but which is a good thing. But so I just say, choose somewhere where you imagine yourself, where it feels like a second home. And if it's Manchester, which is my favourite city, then that's great.
I think that's a really good point, because you can, whichever medical school you eventually go to, you'll get a medical degree at the end of it. And because medical degrees are so highly regulated anyway, then we teach roughly the same stuff. Whichever medical school you go to, you'll be taught the same stuff. So the way the course is taught, the university, the city that it's in, the patient population that medical school serves. So if you go to one of the smaller medical schools, the teaching will be different. The ethos of the campus will be different. Hull, York, and Keele have slightly different patient populations than Manchester or Liverpool or Birmingham or one of the larger cities. And it depends. It's what you want from a city and from a medical school.
Yeah, oh, sorry, I was just going to say one thing.
It's like, how do you get in? I think
Yeah.
it's a privilege if you can choose, but I think that's also something.
Yeah, and I was just going to say, like, there is a very diverse patient group in Manchester, which is great, because wherever you end up as a foundation doctor, you might end up somewhere completely different to where you studied. So you kind of want to have that experience of being with lots of different patients from lots of different, like, socioeconomic backgrounds and different, like, cultural backgrounds as well. And like also, like, Manchester's quite close to the Peak District as well. It's like, so if you just want to escape from the city, you can just get on a train and go there. Like, I've done that quite a few times with my housemates. So there is something for everyone. There's city, there's country, there's everything.
Great. Anything else, anyone? Yeah.
Have you adjusted the course content or the structure of the content as a result of the pandemic in any way, or
Have we adjusted
was
the...
that always in your sort of mindset about COVID and then potential future pandemic?
Yeah, so thinking, have we adjusted the questions? Have we adjusted the course structure for the pandemic? So we went through, so as a medical school, we've always continued teaching throughout the pandemic. We did in 2020, 2021, we moved a lot of teaching online, as was the government guidance at the time. But there have been some interruptions to that. But one of the things that the government was very clear on was that we couldn't interrupt the supply of medical graduates because it wouldn't. In fact, actually, what we did, we graduated some of our final year students early, a couple of months early in 2020. As it happened, they weren't really required, but a lot of our students did work as volunteer vaccinators. A lot of our students did really, really good work out in the community at the start of the pandemic. So did the program structure change? Yes. So we had a period where lectures went entirely online. Clinical skills is obviously always face-to-face because you can't really do clinical skills in an online. Actually, we managed to do some in that you can kind of thinking about how the program has changed. Is we are doing a lot more. We've created a lot of video resources. So thinking about clinical skills. So whereas in the past, when we were teaching, we might have some pre-session work that we would give the students to do, but often what we would do is you'd be timetabled to turn up to a slot and we would teach everything. We'd do a plenary lecture, like a little 15-minute, this is how you do a cardiovascular examination, get somebody up at the front, do a demonstration on them, and everybody would be sat watching while we did that. We're doing a lot more where we pre-record some of that stuff so that you get access to it before the session and then you spend more time in the session actually practicing the skill. So that's one thing that's really good. We've got a lot more video materials. We've always had video materials, but we've got a lot more video materials now. In terms of managing future pandemics, we hope there isn't another one. We'd be guided by government guidance at the time as to how we would sort of change the curriculum to sort of suit that. We still taught everything. I mean, guys, what do you think? That's an interesting question. How did it go for you?
For anatomy, I think it was a good change because we now have this online resource as well called Complete Anatomy. So it's an app and you can it gives you a 3D image and you can build a skeleton, add the muscles, add the nerves. So you can actually see like which which muscle like the nerve is going under or on top of. You can make it, the arm move so you can see like the action of each muscle. And that's really helpful actually because using that, I can like figure everything out and see it in a three-dimensional screen. So when I come to anatomy and see it, I'm not like, oh my God, what is this? Like, because when you see something in 2D and then trying to learn it 3D is really hard. So having that, and that's something that was a new addition because of COVID. And like, we still have that and like, I'll still use that now. So I think that's a really good thing.
That's really good. I mean, anatomy has changed quite a bit.
Yeah.
Initially, we obviously, our dissecting room was the overspill mortuary in the emergency plan for the hospital next door to the university. So we cremated all of our cadavers, or most of our cadavers were cremated. When at the very, very start of the pandemic and the government expected hundreds of thousands of deaths, we basically got rid of all of our cadaver stock and left the DR open for obviously the deaths that were expected from the pandemic. So that left us for a year with very reduced sort of specimens. So we did a lot of online stuff. We brought in ProSection, but that's starting to return to normal now as we get more donations in. Yeah, really interesting question actually. Anything else? Yeah. Yeah, sorry.
How are the students assessed every year? So there are some written exams, and then or they are only going through this portfolio. And
Oh yeah. Okay, brilliant. Tell us about the exams that you sit.
Okay, fab. Best topic, obviously. But generally speaking, so you've got two elements of exams throughout the years. You've got the practical exams, so the in-person exams where you try and either take a history from a patient under exam conditions, or you have to do a physical examination on a patient that's there, the actors mainly, in exam conditions. So that usually happens at the end of each year. Midway between, so after the first half of first year, what happens is you have so written exams, they're multiple choice exams. There's two types. So the first one is a semester exam, and what that basically means is for that period in the first half of the year, you're just assessed on that content that's there. So you have that exam, and then you also have something called a progress test. This is an exam where it's 125 questions. Every single individual in medical school from years 1 to 5 has that exam. And what it basically is an exam you will sit every time with the whole medical school, but what you're trying to see is the progress, like how much you progress over the years. So initially in years 1 and 2, it's not that much high of a percentage, but then you'll start to see, the increase in knowledge that you have. And it's on a range of medicine. So those are the main exams, but then you also have your personal and professional development portfolios that you have to, make sure that you've signed off and had that meeting where they've reviewed all your work. You also have a research element to the medicine degree, so you've got a personal excellence pathway. Basically means is you'll have a research project each year, and you're assessed on it either in a group or an individual, like an essay or a poster. And that's an assessed element as well. So that's that. And then I'm also thinking what else there is. In clinical years, what happens is you get signed off on your examinations that you do. There's select things that you have to do, for example, if you know how to read a urine dipstick, etc., and you get signed off every time. So that's kind of like an examination, like there and then on the day. But then you start to see them as just part of the job where you have to, go to the wards and get signed off, being supervised by a doctor, and then they basically just say, yes, you're competent to complete that examination. So for us, what happened is with COVID times, because I was in the year 3 of medicine at the time, because we'd had those signed off of our competency, like we were able to do that examination throughout the year, it meant that there was less disruption for when we didn't obviously have the main exams, because we were already assessed throughout the year. There's a lot of exams, but then they happen at the right time after you've learnt the chunk of knowledge that you need, just to reassure you.
Yeah. Brilliant. Any other questions, anyone? Yeah, one more, that's great. There you go.
Obviously the modules are quite broad. Do you think there's quite a lot of sort of self-directed learning as well?
So, do you want to do this first? Okay, go on.
As in, when you say modules, do you mean like the content for like semester 1, semester 2? And your question is there a lot of self-directed learning? Yes. So yeah, I mean, you have like a case open at the start of the week, case close, and it will be on a certain case. So I think, for example, like pregnancy might have been one of the cases. And there'll be lectures that go along with that case. So you're not like going down like a blind alleyway. You do have direction, but there is, because you come up with a learning agenda as a group and you come up with questions, you have to do some self-directed learning so you can figure out what the answers are to those questions. So there is like a baseline there with the lectures, but you are expected to go away and do your own work at the same time. And there's loads of like online resources that help, and there's loads of like societies in medicine that like, there's like MedEd and all of these different societies that send out resources that you can use for that case. And that's what I did in first year. I just used those and like it worked for me pretty well. But yeah, I would say there is a significant element of self-directed learning. Anything you want to add?
I think yes, but not to the point where you're literally teaching yourself the curriculum of medicine on your own. Because I think when I first thought of PBL, I didn't know what it was. Whereas throughout, when you have this, you know, as you said, the lectures that are this, you know, fundamental knowledge you need, and you have the learning agenda to go against, you almost know what you're looking for when you're researching. So it's still controlled learning. So you still know what you need to learn. There's what's good to know, nice to know. There's a set way of doing it in medicine because it's so broad. It's things are what's nice to know, what you need to know, and then you just basically categorize the topics based on this is what I definitely need to know, and this is what, you know, it would be nice to know if I had the time.
Yeah. It's part of the journey is becoming comfortable with knowing what you don't know, and just, so I suppose until now, even if you're a graduate, you know, you've had a curriculum, you've learnt the curriculum, you passed the exam, and that's definitely what it's like at A-level and GCSE, is you know what you need to learn. In medicine, there's a core, you know, basic core of knowledge that you need, but you'll never know everything. And it's just not possible because there's so much in the curriculum. You'll never know everything. You have to become comfortable with what you don't know, and I think that's a big shift from doing an A-level or doing a GCSE. Is that, you know, you can learn all of the GCSE biology curriculum. You can't learn all of medicine because it's just not possible. But anyway, thank you very much, ladies and gents. Good luck. We're here if you have any questions, and hope you enjoy your visit today. Thank you.